Prime Minister Lee Hsien Loong will talk about Singapore's COVID-19 situation and its next steps in a live broadcast tomorrow at 11 a.m. Mr. Lee says the situation is improving with the Omicron wave subsiding. He says Singaporeans are also gradually learning to live with the virus. PM Lee's speech will be available on MediaCorp channels and his Facebook page. His previous national address was last October when he talked about the country's path to a new normal. In the months since, Singapore has taken steps to live with the virus. Just last week, the country's COVID-19 task force rolled out what it called streamlined measures after initially delaying the move due to an Omicron surge. It said the wave of infections linked to the variant had peaked. Let's take a look at the current situation with the latest figures from Tuesday. Well, Singapore reported more than 13,000 cases. It shows a gradual downward trend from days when the figure hovered around the 20,000 mark and beyond. Overall, Singapore has reported more than 1 million cases since the start of the pandemic. There are about 860 patients in hospital. This includes those sent to converted treatment facilities because their conditions are deemed to be more stable. In the last 2 months, hospitalizations peaked at more than 1,440 patients in March. The number of those seriously ill is also down. 141 need oxygen support, while 24 are in intensive care. During the Omicron peak, the number of patients in ICU went past 50 on multiple days. 6 people died on Tuesday. That brings the total number of fatalities from COVID-19 in the nation-state to some 1,200 since the start of the pandemic. At its peak, 18 deaths were reported in a single day. A major factor in Singapore's decision to live with COVID-19 is the sheer number of people here who have been jabbed. 92% of the total population have done so, while 7 in 10 have also received booster shots. Given the current situation and the overall risk of transmission, an infectious diseases expert believes some measures can be loosened with little risk, even as others are maintained.
Dining, we could go up to 8 to 10 people, and please have it in even numbers. You see, in the dining hall, in a restaurant, even in indoor settings, the risk of anyone passing from one table to another is very, very easy for the virus, even though we have a 1 meter safe distancing. The second measure which we can consider is actually opening up our borders. From a country with low transmission to Singapore, the risk of transmission is actually higher coming in. Let's be realistic. Open the borders so that travelers can come in and Singapore can have their mini holiday. Clearly, masks must still stay on. Masks do help in transmission. And you realize that safe distancing, though is encouraged but not compulsory, is hard to maintain. I would like to see a restraint in office going back to work because people in their own cubicles get very, very comfortable and you can imagine masks coming down, eating very frequently and easily. And in a large office, in an open concept, we can actually see a rapid transmission within one office.